recently we've had a lot of patients coming in suffering from dizziness and vertigo. We thought it'd be worthwhile us having a chat about the different kinds of dizziness, causes, and how we can help you.
Okay, so dizziness. What is dizziness? It's an experience, it's a sensation, it's one that most of us have had in some time in our lives. And there are many causes of dizziness. But why might someone present to a physiotherapist with dizziness or to a doctor with dizziness? It's a sensation of disequilibrium, lack of balance, a sense of not being orientated in our space and our surroundings. It can have an unpleasant feeling that may be accompanied with a sense of nausea as well. And that's a communication of our body to say something's not right. Many of you know I say pain is just a communication. We tend to run away from it, but actually listening to our body and realising that it's trying to communicate something to us is a really important part of any healing journey. So common reasons why might be the inner ear, something to do with the eyes, or something to do with the upper neck. There can be other reasons, blood pressure, anxiety issues. It can be associated with breathing pattern problems, anxiety issues, panic attack. Of course, there can be other issues which are more sinister in nature, brain tumours and so on and so forth. All of these things, as a skilled practitioner, we can assess for and either treat or refer on accordingly. So let's look at the main area where physiotherapy might be useful. So let's look at the anatomy of how head and neck orientation is perceived by the body, and why that might go wrong and why that might create disequilibrium or dizziness. So our sense of orientation of our head and our being in space is very much associated with what our eyes tell us, what our inner ear tells us, and what the joints of the body, particularly the upper segments of the neck, tell us. We've heard about this vestibular apparatus perhaps. So you may have read elsewhere, if you're interested in this subject, about these semicircular canals, one circular canal in each plane. And there's water, a liquid within the semicircular canal, and some hair-like projections called otoliths. If you imagine a bucket with water in it, and you spin the bucket, and you ever played with it, then you realise that the bucket sort of moves around the water. Well, if you imagine that that's like these otoliths, and that there are hair-like projections on the inside of the bucket, then they would be affected like seaweed in the water. They would be affected by that. Now, when they feed information via the nervous system into our body, into our brain, then we're able to sense movement in each of these three planes, and that gives us a sense of our orientation in space. Of course, we have input from our from our eyes, which tell us about where we are in space, whether we're looking up, looking down. Our orientation in space has in part to do with our eyes. Our upper neck moves as we move around, and so it's important that these proprioceptors, these joint receptors, are also listened to by the brain and correlate with the information from our inner ears and our eyes. These proprioceptors, there are more of them in the upper three segments of the spine than there are elsewhere in the spine, significantly higher proportion, and we believe that that is largely associated with their importance of control of the body and orientation of the head in space. If we get any disruption to any one of those three, then that will create a lack of coordination and congruency of the three sets of information when we perceive it in our brain, and we will perceive that as the sensation and the experience of dizziness or disequilibrium. So, for example, if we go motion sickness, we're in a car or we're on a boat. When we are maybe on a big boat down below deck, and the boat is moving around, and perhaps the top of the door or the bar or something like that is moving, and because it's a big boat, we're moving with it. So our eyes might be sensing that the door remains level, and perhaps even our upper neck might not be moving that much, because if the whole of the body is going, then that's saying we're not moving. But back to our bucket of water, that will unquestionably move. And so the inner ear will be sensing that there is a change of movement. Hence, we've now got a lack of consistency and congruency between the three primary inputs. And so we will then begin to feel unwell. We might then go out onto deck to get some fresh air. It's less to do with fresh air and more to do with our orientation at looking at the horizon. Or if children are sick, look out of the window, stop looking at the comic or the magazine or what's in the back, look at our surroundings and our horizon, and we will orientate and start to feel better. And that's because we're bringing the three things into line. We're now going, I can see that I'm bobbing about, I can see that I'm moving, that correlates with what my inner ear is telling me, and we begin to feel better. So what, and how might that relate to a problem that then on dry land causes somebody to come and see us? If we get a disturbance to the inner ear, or something like Meniere's disease, or some kind of problem with the vestibular apparatus, BPPD is a common one that people that are watching this video might have been diagnosed with, then this could be a disturbance with this vestibular apparatus. Then we'll talk in a moment about some of the things that we may be able to do to help patients who have an actual problem with the inner ear. But it's a personal belief and an experience of mine clinically that this is often overdiagnosed, and that vestibular therapy can often miss the upper neck. And if you try to treat someone with dizziness and you're not paying attention to an issue that's going on in the upper neck, then you're never really going to resolve the issue. And it's really important that we address that issue if we're going to resolve the dizziness. So coming to the inner ear, then if we have a joint that's stuck and can't move properly, then we're not going to be able to sense this movement and move around properly. And so we might get a sense that perhaps we're not moving when everything else is saying we are, and that can create this sensation of disequilibrium and dizziness. Obviously, if we've got some optical problems, which might require you to see the optician, or we've just had some ophthalmic surgery, or we've got something going on with the optic nerve, then this, of course, could also contribute to dizziness. Aside from that, then there can be other causes. We've all maybe woken up with having drunk a few too many and a bit of a migraine or a headache and feeling nauseous and unwell. And so clearly not all dizziness is caused by these issues in the upper neck, ear and eye. So, chemical imbalances, toxicity in the body, all sorts of things can make us feel unwell. But things that we might need to look at and present to the clinic might be blood pressure, for example. And of course we can take people's blood pressure, we can look at it perhaps in the older population, postural hypotension, where as you sit up suddenly, that could be that you notice you're dizzy when you sit up suddenly, and that can simply be due to either problems with the heart, or it can be due to problems with the patency of the blood vessels reacting quickly to noticing that we now need to stop pump blood uphill and get it to our brain quickly. And if there's a bit of a delay because we're getting old and the blood vessels are becoming a bit looser and slacker, then that can start to mean that we get this momentary disequilibrium as we sit up. And it might be that we then assess that, diagnose it, and then refer you on to specialists or your GP to address those blood pressure issues. So it's worth noting that many patients have issues with headache and migraine associated with dizziness. And I think that that's because of the connection of the upper neck. And so if you are noticing that you're also suffering a few more headaches, or maybe you've got a history of migraines and then you're beginning to experience some dizziness, that will be a very important clue to me in clinic, that we really do need to take a close look at your upper neck and see what the connection is there. And we may be able to actually kill two birds with one stone and address those long-standing migraines along with the dizziness. So mobilisation, manual therapy to the upper neck can be an important part of correcting dizziness. If it is issues with the vestibular apparatus and the inner ear, then there are procedures like Dix-Hallpike and the Epley manoeuvre, which we can perform, which can help to reset some of these crystals within the inner ear. They can be helpful procedures in some cases, but my experience is that seems to be the sort of be-all and end-all for treatment of a lot of dizziness, and I think people are missing out on these other causes of dizziness. So vestibular rehabilitation might be important after something like Meniere's disease, where we might need to go through some retraining and exercises to help the body to retrain, to listen to the correct sensory information coming in and to read that information correctly so that they begin to feel correct orientation in space. So it's worth talking maybe about one or two other causes, and many of you know that I have a particular specialism in sort of nervous system dysregulation issues, anxiety, trauma, panic attacks, etc. And the nervous system is very responsible sometimes for senses of dizziness and disequilibrium, partly because that can be to do with our breathing. You know, if we overbreathe in a panic attack, and I have done video on panic attack, and if you haven't seen it, we'll put the link below in the comments. Please take a look at that if that's something that you also think that maybe you experience. So that is very much an overbreathing thing, and a change of the oxygen and carbon dioxide ratio in our blood, perhaps from overbreathing in association with anxiety and panic, and that chemical imbalance within our body can lead to a sensation of dizziness and disequilibrium. So again, all the clues are in the history, and a really thorough assessment, all treatment, successful treatment, I believe is based on a thorough and accurate assessment of you holistically, knowing what else is going on in your world rather than just trying to treat a label of I've got vestibular problems, I've got this. It's you come into the room, we take a look at you, and we take a thorough history of you, and then go, there's some clues, I've also got that I thought was disconnected. And when I start to draw these things together, that I think creates the right recipe for you. So it may be also that if we've got trauma or nervous system dysregulation, that through the nervous system, which fear, fight, flight reactions we will all know make our heart race, or have sweaty palms or something like that, and our breathing rate change. These are normal things. But when we get issues with that, or we're suffering anxiety issues, or we've got some previous trauma which causes nervous system dysregulation, that can then start to have impacts on heart rate and blood pressure regulation, which, as we mentioned before, can create these sensations of dizziness. So it may be that we need to help with some of the more nervous system, stress, anxiety, panic attack, breathing regulation, or other tools to help regulate the nervous system better to address the dizziness. The clues are in the history, as I always say, and that's the route to successful treatment. So I hope that's a little bit of an insight into the role of physiotherapy maybe, and what I can do to help people suffering from dizziness issues. It's not an exclusive list by any means, but I think it covers the majority of points that we see on a regular basis. If you want to comment below, please do. If you think I can help you, please give us a call, book in, and I'll see what I can do for you. As ever, if you've got people that you know, friends that you care about that might suffer these issues, please share the video to try and reach out to the community that suffer with this problem so that we can help them. Thank you for listening. See you again.